So I'm here at the EVTM Symposium with Omar Jibrel, a general surgeon from Bahrain. Thank you for participating in this interview.
You're welcome.
As a general surgeon from Bahrain, you've come a long way. Why have you chosen to attend this EVTM Symposium?
Well, basically, the concept of endovascular techniques is quite interesting. The minimal we are, the better results we can achieve, and the less harm we can do. So the concept was quite exciting, and kindly Dr. Talhura invited me to do a participation in this symposium, which was very nice.
What in your practice back home in Bahrain, what do you think these new endovascular techniques? How can they help you in your institute?
Well, they can definitively reduce the mortality in trauma patients. They can achieve a lot of reach new frontiers within whether trauma surgery, vascular surgery, even general surgeries who work within these two specialities can achieve a lot with this new concept.
And as a general surgeon, what in your practice, how are you involved? Are you involved in vascular surgery or trauma surgery in any way?
Mainly recently involved in vascular surgery in this manner.
Okay.
And in vascular surgery we can achieve that in many aspects.
So in Bahrain, that general surgeons are the one that perform the vascular, so you don't have specialists?
We have vascular surgeons, but we are very short in vascular surgeons, whether residents, fellows, or even consultants and specialists.
All right.
So to fill that gap, those who come in that place are mainly the general surgeons. And I believe even general surgeons have to have a grasp on this important concept.
Absolutely, I completely agree with you. Are endovascular techniques used already in Bahrain, or is this something that you're trying to implement?
Endovascular techniques in general are used and implemented mainly by the vascular surgeon, but REBOA, as far as I know, nobody knows it. Nobody utilizes it, unfortunately. So I hope to take this concept back home and to be adopted by my fellow colleagues. That would be fantastic, to achieve something, I mean.
So it's specifically REBOA that you've been interested in at this symposium?
Oh, yes.
Yeah. Which other endovascular techniques specifically are used at your institute or in Bahrain as a general by the vascular surgeons?
I mean, if you look at EVA or TIVA or other such minimally invasive vascular endovascular techniques and stenting, they are the main ones utilized. But REBOA, it's a new frontier, something very new. Because the specific thing about in Bahrain, I mean, I come from Jordan, but I recently moved to Bahrain. The idea is REBOA mainly can be utilized in trauma, sometimes in other areas of vascular surgery. But trauma surgeons in Bahrain are general surgeons, mainly from the old school, who this is a very new concept. Even back home at Jordan, this is a totally new concept for the older generation. It's something new. Maybe they will take some time to adopt, but I'm interested, both the old school and the new school, the residents and the specialists, to adopt this idea because it's fantastic and the results can speak from themselves.
And you mentioned that the REBOA will be used in trauma, but you already do endovascular techniques such as EVAR, but do you use the EVAR as an endovascular technique in trauma in any way?
As far as I know, no.
No, okay. This implementing it and trying to get both the older generation and the new generation to adopt this new REBOA technique, I can imagine that there might be some resistance in maybe the older generation learning new techniques. They've been doing certain procedures within trauma for many years and they feel comfortable with that. Have you experienced this in any way?
I have experienced this, whether in Jordan, Saudi Arabia or Bahrain. I mean, mainly in the region. There is resistance about this concept because it's a new concept. Some people, I believe, will adopt it if numbers can speak on themselves. And yes, they speak from themselves because the results are very good. And the net result and the sequelae, you achieve sometimes as good as open techniques, with less harm. And we are speaking mainly about trauma patients. That's what I'm interested in. And even other specialties can also benefit from that. So it's a great thing, and it must be adopted there for the sake of the patient and also for the best of the fellow colleagues.
And how do you plan on implementing it? Do you think that you try and get both your residents and your or the older generation of surgeons to attend certain endovascular or REBOA courses, or are you going to do that, attend these courses yourself, and then maybe have a course yourself and try and implement the technique back home?
Well, maybe a hybrid solution of both bringing the heads of departments and on batches, some younger generation, maybe residents. I prefer residents better than younger generations, and even specialists,
of course.
And consultants on stages in a structured manner, in courses, hands-on, in a very on simulations, on cadaverics, even maybe to grasp the idea of the concept, how to adopt the concept in a structural way, to participate in fantastic symposiums and even conferences like these, so that we can move to the next stage, which is the minimally invasive approach, which is the fantastic stage. That's what the future lies on. We will always need in some indications for open technique. There is debate about that, but we cannot deny the importance of minimally invasive approaches, like REBOA and endovascular techniques in general, and other ways.
Yeah, I also agree with you. It's the endovascular techniques, they're here to stay, and like, if you like it or not. And I think it's very important that you try and implement them in the right way. And also, as you're saying, I totally agree that open surgery is always going to have a place in trauma surgery, at least. EVTM is not just about endovascular techniques. It's also about the multidisciplinary approach to the trauma patient. How is there a multidisciplinary approach to the trauma patient back home in Bahrain in the emergency department?
There is, absolutely, there is. We always have to consider the role, of course, the nurses, anesthesiologists, intensivists, etc., all those who take part in the critical care team or the trauma team. Of course, surgeons in general, whether general or vascular trauma, etc., participate in a vital role in this way. But the most important thing is that we have to take also those to participate in such structured whether conferences, symposiums, or programs, to also benefit all in a multidisciplinary approach even. Yeah, and that's very important. Thank you for the question.
Yeah, and apart from the physicians, you also have other staff, nursing and so on. Do you think it's important that even they come to these events, or that we maybe should have special endovascular trauma management events for other parts in the
Yes, definitely. Definitely. Yeah. For example, nurses, technicians, anesthesiologists. I mean, unfortunately, these numbers are quite few compared to the vast majority I have noticed are mainly the surgeons and critical care physicians. To a lesser extent, interventional radiologists, let's say more anesthesiologists. And they are very vital and very important for our teams. So I hope next time I can bring more colleagues from these specialties, also with my colleagues from my specialty, to learn more and how to organize and take this experience back home and spread it within different countries to benefit mankind, patients, and even colleagues.
That's very... apart from REBOA and the multidisciplinary approach we just discussed, is there been anything else while you've been here at the EVTM Symposium that's caught your eye, something else you would like to bring home?
I hope we can cooperate in this very important issue about structuring courses that not only REBOA, vascular access in trauma patients. It's very important, and very, very few know how to do it. And unfortunately, till now, there is the blunt approach, which I think is traumatic with many complications, hematomas, etc. I prefer the ultrasound approach. And the results also, again, speak about themselves with the presentation from my colleagues at the EVTM. More approaches to other people involved, like nurses and other people to get involved. Unfortunately, I didn't see that. I hope we can see that. Sorry for this critique, but it's very important to get other people also involved. I mean, from other countries. Maybe here in Sweden, there are some allied healthcare workers, nurses, anesthesiologists, but unfortunately, from my place, there isn't much. I hope we can invite them to take a glimpse of how fantastic this is and how can we enrich their experience.
That's great to hear. You mentioned vascular access. Who performs the if vascular access is performed in the emergency department, who performs this?
Usually experienced vascular surgeon or experienced trauma surgeon.
Okay.
Yeah.
So this is not a job for a resident, for example.
And that's the gap. Yeah. And that's the gap where residents are excluded, unfortunately, because usually sometimes they and the specialists in general surgery are the first responders.
Exactly.
So if they are not trained, we are missing a lot.
But I can imagine that, for example, your residents will be much more familiar and feel more comfortable in, for example, doing a thoracotomy and putting a clamp on the aorta.
Exactly. Thank you, Dave. Yeah. Yeah.
So yes, it's very interesting. Even though performing a thoracotomy and placing a clamp on the aorta, for me, coming from Sweden, is a much more difficult procedure to do than vascular access. It's interesting to hear that even such a technique that it doesn't matter how basic the technique might be, you still need to practice and train to feel comfortable in doing it.
Yeah, it should go parallel, if I may say, open techniques with the minimally invasive techniques, the vascular or endovascular, like Reboa, because we will always need the open techniques, but we must take ourselves to be involved and engaged in the minimally invasive and new vascular techniques.
It's interesting you mentioned that, because I think that is one of the key concepts for EVTM, is the hybrid or the approach to the patient, that both endovascular and open techniques don't contradict each other. They can be used simultaneously in the patient and actually help each other. Yeah. Here in Europe, we very much, and also America, we very much enjoy having our hybrid suites where we can perform such procedures with endovascular and open surgery. Do such hybrid suites exist in Bahrain?
Unfortunately, no. I hope we can adopt that, but at least to adopt the technique of Reboa within the ER, and to try to implement that, because that needs planning with the politicians, with those involved in budgeting the healthcare institutions, whether private, governmental, even military hospitals. I mean, the facilities have to be approved within these budgets to adopt. So we have to bring this concept to be accepted from all the parties, and then try to benefit from your experience, which was lovely and vividly presented here, and we can also achieve a lot from that and learn a lot from that.
Yeah. And what do you think that we can learn from you as an endovascular trauma management organization? What do you think that we might be lacking, and that you might be able to help us in pushing this concept forward?
Interesting question. Well, unfortunately, Bahrain is a peaceful country. Even back home at Jordan, it's relatively peaceful and calm. But if you go to countries like Syria, Iraq, Yemen, and even Libya, they have wars. So there is a vast majority of situations and cases where these things, this experience, you guys can come and learn and see. because I'm sure the rarest things you have heard about in the textbooks and in the literature exist,
but never seen.
You have to come and see. You will see that. It's like the crime rate and war zones are the best things for trauma and vascular surgeons to experience hands-on on real life.
Yeah, I think that as a vascular surgery resident here in Sweden, the amount of trauma I see maybe in a whole year is what you guys see in a month, maybe, for example.
Yeah.
Well, I think that sums it up from Omar Jibrel here at the EVTM Symposium. Thank you very much for participating in this interview.
Yeah, thank you.